Today we will learn about hair care. Hair care is cleaning of the hair with shampoo to remove the dirt, oil and odor from the hair and the scalp for those patients who are bedridden patients and those patients who are unable to do the self-care by themselves. Example, unconscious patient, fracture patients, post-operative patients, etc. The purpose to do the hair care first is to stimulate the blood circulation, to keep the hair clean, healthy and promote growth, to observe the scalp, to see for any signs of infections, itching and pediculosis, and to promote a sense of well-being. The articles we require for the hair wash is a tray which is containing of the paper bag to collect the waste, a kidney tray to collect the waste, a bowl which contains a comb to comb the hair, oil to put on the hair, shampoo to put on the hair, but it should be patient's preferable, which is the choice of the patient, a pair of gloves, a bowl in that we should have 2 eye pads to put on the eyes, 2 cotton balls to plug the air during the procedure. This is an improvised trough which is made by the Macintosh. Over that we should put a bath towel so as to for the draining of the water from the hair to the bucket. We have the bath blanket to cover the patient. This is a towel, Macintosh with a towel lining to protect the pillow, face towel to wipe the face after the procedure, bath towel to wipe the hair after the procedure. Patient's clothing, it's mandatory. If the dresses are wet, then it can be used. We require 2 jars, one is for hot water and one is for cold water, 1 bucket to collect the drain water during the procedure, 1 basin to mix the hot and cold water. This is a mug to pour the water. A stool we require to put this bucket during the procedure. Preparation of the patient and unit. For this, first of all, we need to explain the procedure to the patient, that why are we doing this hair care. Then preparation of the unit, that is put on the screens to prevent the privacy, to maintain the privacy. Put off the fans and windows should be closed to prevent the drought. Next is we have to assemble all the articles to the bedside so that it will be convenient for the patient as well as for the caregiver to do the procedure smoothly. Then next is we have to place this pillow under the shoulder and we have to place the patient diagonally so that whatever the waste can be collected into the basin. Next is we have to put the bath blanket over the patient. And we have to pull it up, cover the patient completely. Patient should not be exposed unnecessarily. And the top linen needs to be folded back to the foot length, and patient should be completely cover with the bath blanket. Next, we have to take the Macintosh and the towel. So this part should come to the pillow, this should come to the patient. The purpose for this is so that the pillow will not get the spoiled. Next is our Kelly's pad. And the thread should be tied around the patient's neck and it should be loosely tied. Next is we need to take the bucket and place it over the stool so as to collect the waste. Next is take the cotton and plug the air so that water will not go into the air during the procedure. The next is the eye pad that should be put around the eyes. Steps of procedure: wash your hands and wear the gloves. We have to comb the hair, we have to remove the hair tangles, and the waste hair should be put into the paper bag. Comb should go into the kidney tray. Next we have to mix the hot water and the cold water. The temperature of the hot water should be 110 to 115 degree Fahrenheit, or else it should be as tolerable by the patient. For checking the hot water, we have to see the back of the hand and it should be dip into the water, and we should see whether it is not so hot or not so cold. Then put the muck into the basin. Then pour the water into the hairline so that the hair will be completely wet. And we should make sure that the water is collected into the bucket. Take the shampoo, as the required amount, and start from the hairline, and it should go in a circulatory motion by using both the hands. And doing this procedure, we should observe the scalp for any infections or any pediculosis. Next, we have to lift the head and we should make a ladder. And we should massage the scalp. After that, rinse the hair completely. And we should see that there is no shampoo left over on the hair. We have to see that the hair is completely drained out. Then after this, take the bath towel, keep side, remove the rough knot, the hair should be wrapped. The hair should be wrapped and the trough should go into the basin. Then we have to discard the water. Then after that, we have to dry the hair. Take out the soil ones, put aside, remove the cotton plugs, then make the patient comfortable. Discard the water, remove the gloves, and the bath blanket should be removed and replaced with the top linen. Make the patient comfortable, dry the hair. If it is required, then change the clothing of the patient and do the recording.